Mark Gombotz. I'm Senior Vice President of Operations for Constitution Surgery Alliance based out of Avon, Connecticut. For 26 years now, Constitution has been owning and operating ambulatory surgery centers in Connecticut, Massachusetts, Rhode Island, and have picked up newer locations in Pennsylvania and Virginia, and one coming in New York. I personally have used HST case coordination for about 5 years now, since I started with Constitution. Started in one center for the intake and information sharing with physicians' offices to be able to book cases. We were having a lot of problems with physicians' office communications back and forth on what we needed to book a surgery and or the actual time and date of surgery, and case coordination helped us solve that problem with having a digital transfer of some of that information. I think as technology and people got more savvy and comfortable with EMR transactions at a physician's office level, I think that's what brought us to case coordination. It was a lot of faxes. So it went back and forth, a lot of phone calls, needing different types of documentation, a lot of phone calls, which room, who's following what. Now all that is transparent on both sides, so all that doesn't have to be done via fax or phone. I think it was the ability for the physician's offices to look at the block time of the physician and see how it's being utilized, and also have the physician scheduling on their phone as an app feature. So that allowed them to see what room they're in, who's next, what reps are in there, and that type of thing. I piloted it in one of my centers, and then we started to use it in a few of them that we run. I run 7 centers that have a joint venture relationship with Harvard Healthcare. So we just started to coordinate those between those centers, and some use it and some still do it the old-fashioned way. Much easier from a front desk perspective of what's needed for a case without having to hunt through a file and look and see what's on there. Coordination with, like I said, the reps and the vendors that are in the room too, by able to just click and see that they needed to be in there, x-ray coordination, that type of thing, is really easier now versus before we did not have case coordination. I think we just obviously have a little bit more efficient of our front office use time, and also our nursing staff. So we're not, hunting down and making sure that reps are there, and that the need for text messages offline have been eliminated. So, their time management is probably the most quantitative thing that has been pulled from this. They love the look and see A, what room they're in, B, who's in the room, C, what's needed, and all that has been done prior to the case. They can see all that now, so that the physician satisfaction is very high. The implementation was good. It's a fairly easy product to use. Front offices sometimes can be a little resistant to change, but even they had no problem adapting to this and adopting it, because it's helping them with their workflow, and obviously having the need to pick up the phone less and interact with other physician offices less was very helpful. Not much. The product runs well. We haven't had much case customer service needs to call, and when we have, there have been resolutions, so no issues at all. Good question. I think anybody now, because we're very piecemeal in how we're doing our practice management, our preoperative intake with patients, our patient engagement, our practice management software, our EMR, and then our outcome surveys. So we're piecemeal, and I think we look at like a whole type of enterprise solution, and that's what we may investigate in the future. They have all those things, so it could be a possibility where we investigate that. Clearly, we're using one of the products and we're using it and like it, so why wouldn't we look at the other products they have?